like to know why it's very important to ensure that babies cry after delivery. Why is it that the healthcare workers are usually bothered if a baby doesn't cry after delivery? I'm here to be talking to us about the importance of seeing that a baby cries immediately after birth. Now, there's a condition called birth asphyxia. This is what happens or what sets in when a baby does not cry after delivery. Now, let me explain this properly, how you can understand it. You know that when a baby is in the mother's womb, that baby is inside a fluid called amniotic fluid. It's like the baby is submerged inside the water, inside a pool of water. Now, when you give birth to that baby has been comfortable breathing inside that pool of water through the placenta of the mother. When you cut off the placenta, when you bring out the baby from that pool, and you cut off the placenta, there is going to be need for the baby to adapt to breathing outside the water. That is using the normal air now, the room air, to breathe in air on his or her own without the placenta helping. So that initial cry, what it does is when the baby opens the mouth and cries, that pressure goes down to the lungs and pushes out that fluid that the baby came out with from the mother's womb, pushes it out, and air goes in. So when this air goes in, a lot of things happen at this point in time, but the most important one I want to talk about is that oxygen is able to circulate around the body, including the brain. Now, when it's difficult for this baby to cry or did not cry well after delivery, you see, there's not going to be enough oxygen that is going to get into the lungs, and there is going to get to the brain. And you know one thing, the brain cannot survive for more than 3 to 5 minutes without oxygen. The brain will start dying. So when these babies come out and they don't cry or cry well, we are worried because the brain and some other vital organs are being starved of oxygen. If this gets prolonged for a long time, that child is going to come down with a lot of brain problems. And you see some of these children having what we call cerebral palsy. The baby cannot carry the neck, the baby cannot sit, the baby cannot crawl, the baby cannot walk. A lot of functions of the brain will be impaired because the brain was starved of oxygen at birth. Now, what is this teaching us? Number one, if you are a patient and you know that you have problems when you are pregnant, if you're a pregnant woman now, that's what I mean by a patient. You know that you have problems when you were pregnant, problems of diabetes, problems of hypertension, because these are some of the things that can predispose these babies to having this problem. Please ensure that you are going to be delivering that baby in a facility where there are doctors that can handle any situation that comes up at birth. Such deliveries are not deliveries that should be handled in a maternity. Now, number two, if you are a healthcare worker and you see these babies, you notice that a baby that was delivered in your facility did not cry well at birth. Encourage the caregivers to move this baby immediately to a center where this child can be handled. A center preferably that has pediatricians. Pediatricians are people, doctors specialize in taking care of children. Or better still, neonatologists. These are doctors that specialize in taking care of newborn babies. Because this baby is going to be needing high pressure oxygen. We're going to be needing to put this baby in oxygen, high pressure oxygen, that will be able to help to push out this fluid from the lungs and then try to initiate this circulation I talked about initially. Stop beating these babies. Sometimes you see babies brought in to you with palm prints of the people that conducted the delivery on the backs of these babies, on their buttocks, on their legs, hitting them for them to cry. That is not where the problem is. What is going on is not because the baby does not want to cry, but because the baby is not able to cry. They are two different things. So when you hit a baby and hit a baby, you injure that baby. You give them bruises on their body. You give them prints on their body, and you see the whole body turns red, and the child is even very uncomfortable already, and you're worsening the situation of the child. So what is this teaching us today? handle the kind of problems that you can handle in your facility. If you are a healthcare worker, if you are a patient and you are told that you have a problem in your pregnancy, go to centers where you have skilled and trained healthcare workers that can solve any problem that comes up after delivery. I want to be ending it here, and I want to believe that we have learned something from this video today. If you're just coming across this video or this page for the first time, please hit that follow button. Please subscribe, please follow, like, comment, and thank you. Watch out for more interesting topics on this page. This is Dr. Eddie saying bye.